Welcome, thanks for joining us this afternoon. It's great to talk to you about Mycare and what you're doing in the community with that. Can you explain to us a little bit more about the creation of these connections that you talked so passionately about earlier, and how you see Mycare filling that space and enabling that future to occur?
Yeah, sure, thanks. So on every street in New Zealand, there is someone looking for some sort of care or support at home.
Yeah.
And on every street there is someone who is looking for a little bit of part-time work. And so what Mycare does is help make the match between those two people.
Right.
So you can sort of call it an Airbnb of home care. It's not an Uber of home care because you don't choose your own Uber driver. It's about choosing someone to come into your house. And so, our sort of belief is that we want to give people full choice over who comes into their house. And we've built a community of about 10,000 people right throughout New Zealand now, and in every area, rurally, in urban areas, wherever you list a job on Mycare, we can help find you some people to choose from. So what happens, people go onto Mycare, they create a job that I need someone to look after my elderly parent or child who's living with a disability, or we just use it at home from my flat. We have a cleaner come in, she's amazing. Her and her husband, they come in, one helps with the garden, one does the cleaner, and it's a peer-to-peer platform. So it's a contractor service where people list a job, and then somebody says, I'll do that work. We take away all the administration by enabling them to easily contract each other, and we pay the tax as well and provide insurance and safety checks.
Okay, so that really exists in that construct of social license and that trusting perspective sort of between members of our community who don't know each other. How do you see Mycare enabling that, or how do you see that evolving in the future in terms of other apps as well? You know, this is a big, a large amount of potential here.
That's
in
right.
This space.
I guess the social license aspect is really crucial. We're moving as a society from a sort of institutional-based society to quite a distributive one, where people trust people nearby. We're trying to figure out how to enable people to have local connections and local support systems in place. It builds resilience, it builds community wellness, and it's all about mutuality. But the social license part, as a company, we've got to figure out, well, how do we do this ethically, and how do we make sure it's... I talked today a lot about our engagement with the unions. The unions are really helping us develop a social contract so that we're making sure as a platform we care about both sides. Which we do. So you can only have a platform-based organisation in this, I think, if you care about both sides. We care about the people organising and receiving care, and we care about the workers on there. We care about their training, we care about their development, we care about their career progression. We've tapped into this group of people who are largely structurally unemployed in New Zealand. They have really great experience, they've got great qualifications, but they just can't find work or are not able to work a full-time job due to their family situation. Maybe they're already caring for their elderly parents or looking after a child who lives with a disability. So we're trying to create new opportunities for them. And so I'm starting to work very closely with DHBs around the country on this, and they're getting quite excited around the future of person-centred healthcare, and particularly enabling home services. If you're in a position that you can direct the funding yourself, let's enable them to do that.
Yeah.
And let's measure everything that comes out of that. And what are all those benefits, not just for the person receiving the care, but for the people who are giving it as well. That sense of friendship and connection, that localness, finding a job, some part-time work just down the road. So all of this is hugely, there's a lot of reports out now about the future of work and the gig economy. And this is a big step towards that type of work. Yeah. And what we're really focused on is doing that in the right way, a caring way, and that integrates seamlessly with the existing health system. So allied health, for your example, working with the hospitals on discharge patterns. So it's quite exciting.
That is exciting, and I love to hear about the connections being made and overcoming a number of barriers, really, that often we put in place that can prevent us making those connections and enabling healthcare and also care in the community to occur closer to home.
Yeah.
Thank you, Sam. Thanks for talking to us.
My pleasure.